Assalamu alaikum. My name is Dr. Faisal Anwar. I am Assistant Professor of Ophthalmology in Sharif Medical City Hospital and Consultant Eye Surgeon in the IECure Lahore. Today we will discuss about the vitreous floaters. What are good floaters and what are bad floaters? So what are actually these opacities mean? These are small, minute, tiny opacities that are present in the vitreous gel. Now eye is basically structured with this gel that is formed of collagen and water. Now these two and some other elements mix and they form a vitreous gel. Now when this gel gets contaminated, we call this phenomena as vitreous opacities or the floaters. Now the floaters are of two types. The terminology that we use is muskies. So musky volatiles are basically small flies. These are small particles that are worms that are present in this gel. Now we label these small opacities as muskies. These are not harmful. Again, these are good floaters and they don't need any treatment. So when the light will fall on them, they form their shadow. That shadow is visible on in the field of vision. So when we will see in the bright light, the shadow is more prominent, and when we will see in the dim light, the shadow is dim. It settles down automatically with time, and you get used to it to live with it. The second type of floaters that are present are called as asteroid hyalosis. So what are asteroid hyalosis? These are basically aging floaters. What do you mean by aging floaters? These are mostly present in 60 to 70 years of age, and these floaters are mainly formed due to calcium deposits. So when the calcium deposition is in the vitreous gel, they look like round opacities. These opacities are called floaters. Again, the quality of these floaters is they move with the movement of the eye. They don't get settled down. So these floaters again don't need any treatment. You have to live with these floaters. Again, they will form a shadow on the retina and they will not be harmful. Third type of floaters are called as synchiasis scintillans. Again, these floaters are present in the eye, but they are again not harmful. These sediments in the vitreous cavity, when you will look at them, just when you will focus these vitreous, they will settle inferiorly downwards and they will diminish. Why they form? When any patient, diabetic, hypertensive or any other disease gets inflammation of intraocular structures or hemorrhage, these opacities are basically remnants of those inflammatory cells that were present in the eye. The vision will be absolutely fine, but these floaters will remain there. Again, they are good floaters. They don't need any treatment. Third type of floaters are called bad floaters. They are emergency floaters. They need treatment. They need treatment immediately. So what are these floaters? They are associated with the dimness of vision. They can be because of the two reasons. One is the vitreous hemorrhage and the other is posterior vitreous detachment. Now what is posterior vitreous detachment? This gel, this is the gel that is attached in all the structures of the eye. This gel gets detached. When this gel gets detached, we get a phenomena that is called posterior vitreous detachment. It is an emergency situation. It gets your vision away by creating a tear in the retina or break in the retina. This is called as posterior vitreous detachment, that is associated with the retinal detachment. It will come up with many floaters, so it needs treatment, the emergency treatment. Again, the second type is the vitreous hemorrhage. So when this gel gets detached, there will be a showering blood into the vitreous cavity and again the vision will be lost. So in these two cases, when you will see many vitreous cells, many vitreous floaters or many vitreous opacities that are associated with the low vision, you will get it checked. Treatment of these floaters will be of two types. The number one is if the floaters are due to the hemorrhage, we will inject a medicine into the vitreous gel and these hemorrhages get dissolved. Again, the vitreous floaters will remain there. Second type of treatment is the surgery, that is retinal detachment surgery. If it is present or break is created, we will remove this vitreous gel and we will replace this vitreous gel with the gas, with the water, with any silicone oil or with any air particles. So these are the floaters, the good floaters or the bad floaters. If you are having good floaters, you don't need any treatment. If you are having bad floaters, you have to deal with it. This is an emergency. You have no time and get it checked immediately. Thank you very much.